Hi, everybody. It's Dr. Tenenbaum here doing our weekly Facebook Live, and today is going to focus on abdominoplasties. And I'm so glad that we have this opportunity to kind of share some information broadly to many of you. So I'm just going to wait a little bit for some more of you to join. And also, thank you so much to those of you who sent in some questions ahead of time. It always helps for me to have some questions to start, and then of course I'm happy to answer any of your questions as they come through. So I know last week my partner, Dr. McCatton, talked about liposuction, which is also body contouring, of course, another sort of facet of that. Today we're going to talk about tummy tucks or abdominoplasties. So a little bit different than liposuction, although very, very often combined. So abdominoplasty is a procedure to address the abdomen or the trunk, typically more commonly performed in women, but also performed in men, to address the excess skin and sometimes excess fat of the abdomen, as well as the abdominal wall or the abdominal musculature. This can be important, especially for women who have been pregnant and the abdominal wall has been stretched to accommodate the pregnancy. When that abdominal wall, the musculature and the surrounding connective tissue called fascia gets stretched out, sometimes it doesn't bounce back. So sometimes I describe it like a rubber band that has been stretched to the point that comes back, but then maybe stretched again, and it's stretched to the point where it no longer fully contracts to the way that it was before. And so in those situations, an abdominoplasty can help tighten up those muscles again. I am going to actually share a screen with you here, if I can figure out how to do it, where I'm going to show you some things on our website. Let's see here. If I disconnect or something, I really apologize. I'm going to try my best. Because I'd like to show you some things on our website. I'm not sure that I can figure out how to do this. Share my screen. I could share it a minute ago. Okay, well, I'll try and figure it out maybe at some point here. I apologize, I can't figure it out now. Shoot, and I even have it all up. I was going to show you some diagrams. So basically, let's first talk about kind of who is a candidate for an abdominoplasty. So like any elective, especially cosmetic procedure, these are not medically necessary. And so the first and foremost, most important thing is safety. So we want to make sure that you are healthy enough to have surgery, healthy enough to recover from surgery. So that includes making sure that your doctor believes that all of your medical issues are either non-existent or stable. Your heart is healthy, your lungs are healthy, etc. You are also at a pretty healthy weight. So abdominoplasty, just like liposuction, is absolutely not a weight loss procedure. It is a contouring procedure. So we want to make sure that you're at a nice healthy weight. BMI, which is a measurement of height and weight, is kind of a quick and dirty way that we sometimes tease that out. So healthy BMI is below 24, 17 to 24. 25 to 30 is considered overweight, and over 30 is considered obese. So in general, body contouring procedures are not ideal for patients that are BMI over 30. Again, it's not going to be a weight loss procedure. It's really a contouring procedure. So that is one sort of quick, easy determination that we make. We recommend weight loss. We want to make sure that you're at a healthy, ideal weight. You don't want to have an abdominoplasty and then either gain or lose weight. So you need to be at not only a healthy weight, but a good stable weight. Then from an anatomic standpoint, a candidate for an abdominoplasty is somebody who has excess skin and fat of the anterior abdomen, and we want to remove that area. So removal of skin and tissue typically comes at a trade for a scar. So an abdominoplasty scar, the nice thing is we can usually make that scar very low and hidden under kind of the area where you would wear your underwear or your bikini. So generally that can be a very low, very easily hidden scar. Often there's also a scar around the belly button as well. But again, depending on your anatomy, often that scar is very difficult to see unless you're really looking for it. The scar can be sort of tucked into the belly button, and we can make the belly button look nice and small and cute again. Sometimes women or men who are having this procedure will also have some excess fat in the area, and we can directly remove that, or sometimes we also combine that with liposuction. So we can liposuction the areas of the abdomen, the love handle area, the back. Those are very common things to add to a tummy tuck. I mentioned the muscles before, so good candidates for tummy tucks have kind of that stretched out or loose appearance to the abdominal wall itself. A good way to kind of look at this is when you stand up, you sit up straight and you really flex your muscles, sort of the tightness you get versus you just let everything relax. So that laxity is what we can tighten up with sutures. So somebody asked ahead of time, what type of suturing do we do for that diastasis or that separation of the muscles? So there's a couple of different ways that this can be done. I personally like to use a permanent suture. I use a suture that's made out of nylon. It doesn't ever go anywhere. Your body scars around the stitch, but the stitch itself stays there. Other surgeons will use a combination of different kinds of permanent sutures. Other surgeons will use absorbing sutures, but typically we would never use an absorbing suture that didn't at least stick around for quite a long time. So if a surgeon uses an absorbable suture, usually it's a suture that doesn't absorb for a good 9 months or so, because again, we want to make sure that tissue has really scarred in around the area that we've repaired before the suture goes away. Some people use barbed sutures, so that's a suture that is generally an absorbing suture, but it has little barbs on it to help grip the tissue better. I will occasionally use that, especially when I'm doing what we call plication, meaning the repair, the corset. When you're kind of looking at a picture and you see a picture of the sutures in a corset fashion. We'll do that at the midline between the muscles. That's that diastasis. But sometimes laterally along the sides of the muscles as well. Think about sort of the six-pack muscles and along the sides of those muscles. I will also bring that in with some sutures to help create a more of an hourglass curve to the waist. And again, it's all dependent on what the patient's anatomy calls for. Those sutures I will usually use barbed absorbable suture. Let me just keep going with some of these questions. So for someone with a large gap, are sutures enough or is mesh required? So that's a really good question. People with generally a very large gap, especially if the tissue is extremely thin and weak in that area, we consider that almost more approaching a true hernia. If it's really that wide and that weak, then yes, sometimes I will combine that with a mesh repair. Sometimes that portion of the procedure I will even do in conjunction with one of my general surgery colleagues for a true abdominal wall reconstruction. And then we still kind of make it look good. That's where I come in, make it look good to tailor the skin and tailor the waistline around it. But yes, sometimes we do use mesh. Have we ever had a diastasis reopen after surgery? So that is not terribly common. But not impossible. So again, that's part of why I use a permanent suture. I don't want it to reopen. I want it to stay nice and tight. I want that corset that I'm putting on the inside to really remain there. But things can happen, especially with straining, especially early after surgery. If there's a strain, then you can have a rupture of the suture. Now down the road over time, what can happen, especially with, let's say, weight fluctuations or an additional pregnancy, that tissue can stretch again. So even though the suture is still there, the tissue around it can stretch. And so we do see that occasionally, especially if there's another pregnancy or a significant weight fluctuation. If it reopens, do you reperform the surgery at no cost? So that's a really complicated question because it really would depend on what happened. I've never had a patient of mine sort of reopen from a failed surgery. It would be more one of those things I've said in the past. Have you ever seen insurance pay for severe diastasis repair? I have, and that's the situation that I mentioned before, where I would send you to one of my general surgery colleagues to see if they felt that it was along the lines of almost like a ventral hernia, and then insurance potentially would cover that portion as a ventral hernia repair. My portion, or the kind of the tummy tuck portion, would then be considered cosmetic, but often we can do that joint case where part of the surgery is covered by your insurance and part of it is not. So what is included in our price at West County Plastic Surgeons? So they specifically want to know scars, therapy, consultations, post-op checks, etc. That's all included. So in general, you pay a consultation fee to see us, and then if you book surgery, that's generally applied to your surgery. And the cost will be broken down with the cost of our anesthesia team, cost of the OR at the hospital. If you have an overnight stay, that's included or broken down in your total price. And then our fee for West County Plastic Surgeons does include scar therapy, some of your garments. It includes all of your follow-up care as well. Let's see. Okay, so somebody wants to know, how long after gastric sleeve should you wait? So that's a great question. The biggest thing is, I mentioned this earlier, is having a stable weight. So if you're somebody who's undergone weight loss surgery, or you're somebody who's lost a lot of weight on your own, either way, the ideal time to do any body contouring procedures, whether that's an abdominoplasty or breast surgery or facelift or really any of these types of surgeries, is number one, you've lost the weight that you're going to lose, okay? And you've plateaued and you're no longer losing or gaining. Number two, you've shown that you are stable at that weight for a period of time. My ideal period of time is 3 months. So I want to see that you have hit your goal weight, or you've plateaued where you're going to plateau. And then I want to see that you've maintained that weight for at least 3 months, because as I mentioned earlier, you don't want to go through these procedures and then either gain or lose weight because number one, it's not going to look as good as if you get to your goal weight, have the surgery, and then maintain it. Number two, it might not be as safe, because if you're still really rapidly losing, sometimes nutritional factors are off and things like that. So again, we want to make sure you're stable. Getting to nutritional factors, if you are somebody who's lost weight quickly, especially like in the case of surgery, if you lost it really quickly, sometimes the nutrition factors and things that are really important for healing can be off. So we want to make sure that you are healthy and can heal. And so we're going to do extra blood work on somebody like that to make sure that those factors are all in line. And sometimes we talk about supplementation. Sometimes we have to wait even longer to make sure that supplementation has worked. It's so fun to see all of you who've joined. Hi, everybody. So let's talk a little bit about recovery. So that's something that people often want to know about, especially my moms who have little ones at home and need to really plan, or time off of work, which is really important. So the surgery itself, you're asleep for the surgery, of course. Depending on what we do, sometimes you go home the same day and sometimes you spend the night in the hospital. Folks who spend the night in the hospital tend to be, especially if we're combining it with other procedures, more liposuction, breast surgery, facial surgery, etc., or somebody who lives a little further away, or somebody who just simply wants to spend the night. If you're pretty young, healthy, active, very fit, you live close to the hospital or close to me, and you have good help at home, then I'll let you go home the same day. I typically am able to do abdominoplasties without drains. So drainless tummy tucks are getting more and more popular, and I'm doing quite a few of those. Almost all of my patients, 90% to 95% of my abdominoplasties, I'm doing without a drain. That's because I use something called progressive tension sutures, which means I'm securing the tissue that I've elevated back down to your abdominal wall in a progressive fashion, which helps me, number one, remove more tissue. Number two, it helps take tension off of your scar, so your scar looks better. And then number three, it helps me not leave a drain, because I've closed up all that space that could potentially fill up with fluid. So you'll go home hopefully without a drain. You will have compression garments, so an abdominal binder or a girdle, depending again on the other procedures you've had along with it. when you go home, I ask that you are up and walking. I don't want you to get a blood clot in your leg. So I do want you to be walking around your house, making some laps, but it's going to be really nice and easy just to keep the blood moving. I also ask that you stay a little bit bent at the waist. So what does that mean? It means when you're walking, you're a bit hunched over, and it means when you're lying down, you're not lying flat on your back. You are in what I call sort of a beach chair position or a reclining chair position, so knees up and back up. Some people actually like to just go ahead and sleep in a recliner. Sometimes that's easier to get in that position. Other times people will go ahead and sleep in their own bed, but they will prop with pillows. So pillows behind the back, pillows behind the knee, and we can kind of help get you some of those types of things. Okay, you are going to wear that compression for 6 weeks, at least 4, but I tell everyone 6. You are also not going to do anything strenuous, no straining, no working out at the gym, unfortunately, no lifting more than 5 or 10 pounds, also for 4 to 6 weeks. So again, you're up, you're moving, but you're not straining and you're not doing anything vigorous. Most people can return to work in about 2 weeks, especially if you have a desk job. Now, obviously, if you have a really heavy job where you're lifting a lot or really straining or moving a lot, then we're going to have a different conversation. But most people can return to a desk job in about 2 weeks. Back to the gym, like I said, 4 to 6 weeks. It's kind of a slow ramp up in terms of how you're feeling. People ask, how soon can I do crunches or core work? And my first answer is always, well, I just did about 9 million sit-ups for you, so just take it easy. You're okay. You could wait a little longer, because that is going to be one of the things that takes you a little bit longer to feel good and feel confident doing core work and getting your muscles strong again. A lot of my patients, especially women with really severe diastasis, they actually, after surgery, feel a lot stronger, because not only are their muscles still able to work, but now they're in the anatomically correct position, so they actually can engage them a little bit better, and they actually feel stronger. So that's always really fun. Let's see, what is the difference between a tummy tuck and a lower body lift? So lower body lift, I like to think of that more like a circumferential tummy tuck or 360-degree tummy tuck. So it's not sometimes people hear the word body lift and they go, oh great, I want my entire body lifted. That's not exactly what it means. So think of it still addressing the entire trunk, but whereas an abdominoplasty addresses the front part or the belly, a body lift or a circumferential body lift addresses all the way around the waist. So that's why I wish I could share my screen with you. I'm going to figure this out. I thought I had it figured out and I don't. I'm so sorry, because I wanted to show you some diagrams. So think of where I told you the incision or the scar is really low on the abdomen, kind of hip to hip. Circumferential body lift or a lower body lift, that incision goes all the way around onto the back as well, above the buttocks. So why would somebody have that as opposed to just an abdominoplasty? Well, again, especially folks who've lost a significant amount of weight, they may have some laxity on their sides, on their flanks or their love handle area, and above their buttocks. And so we can address that excess skin and tissue by resecting more tissue all the way around. So generally, for folks that have lost a lot of weight, that's going to be something that we consider. The typical patient who has not had extreme weight fluctuations, but maybe they've just had pregnancies where they have loose skin in the abdomen and they have a rectus diastasis. Generally, a circumferential or a lower body lift is not necessarily something that we consider for those patients. So that's a great question. Safety of abdominoplasty. So again, we take safety very, very seriously. We always do this in the hospital. And sometimes you spend the night, sometimes you don't. But again, that's really carefully evaluated to see who we may want to keep overnight for more observation. We give you medicines before surgery to help with pain. We do anti-inflammatories as well as Tylenol, as well as a nerve pill. We also give you nerve blocks, meaning we inject numbing medicine around specific nerves in the operating room to help control your pain. And we do all of that to try to decrease the amount of narcotics you take after surgery. Not only is it safer, but it's also going to be less side effects. We want you up and moving. Another complication or risk of a tummy tuck is a blood clot. I mentioned that before, a DVT. So often we have you up and moving, but we also may put you on a blood thinner for about a week after surgery or so, depending on the surgery that was done. So that's quite common to do that. Depending on your health history as well. We may do specific testing before surgery to make sure your heart is healthy and your lungs are healthy, etc. We're always going to get blood work, etc. So that's something else to consider. Let's see, safety, and then what else? Most women or men who have this procedure, it's about 75% of women are doing tummy tucks. Patients who have tummy tucks, about 75 to 80% are women, and the remainder are men. So it is not just for women, although it is definitely more common in women. Most of them are very, very happy that they did it. Again, there are some risks associated with any surgery, but this is something that really helps people feel more confident. They feel like now their trunk kind of matches the way the rest of their body looks and feels. It's a better contour, not only the way that it looks, but also the way that it looks in clothing. So not feeling like they have to wear a girdle or Spanx underneath a t-shirt or a dress. It's smoother, it's flatter, and it's just more comfortable. It's definitely something that most people are really, really happy that they did it. Again, it's definitely a surgery. There's definitely some downtime associated with it, but for the vast majority of people, they would do it again in a heartbeat. Of course, there are caveats to that, and that's why it's always really, really important that you are evaluated by a board-certified plastic surgeon, which again is very different than a cosmetic surgeon. That's not really a real thing. It's not really a real residency training. We do 6 years of residency training. Many of us then also do fellowship training after that. And keep in mind, that's all after medical school. And so board certification process and safety is really, really important to us. So make sure that you do your homework and you seek out a board certified plastic surgeon, ideally somebody who's a member of the American Society for Aesthetic Plastic Surgery, or ASAPS. It's really the epitome of good, safe, cutting-edge aesthetic plastic surgeons as well. Be evaluated, seek a second consultation, make sure that you understand your options and the pros and the cons. And so it's not uncommon for me to evaluate, especially women who say, should I have a tummy tuck or should I have liposuction? And sometimes it's a very easy decision one way or the other, but often the patient could really go either way. And it really depends on what they're hoping to get out of the surgery, what their goals are, and then also kind of what they are willing to invest in terms of time and recovery and so on and so forth. But at the end of the day, you want to make sure that your surgeon understands your goals so that they can best help you achieve your goals. Making sure that communication is really key. And so seeing, again, if you decide to have surgery with me, for example, I'm always going to see you at least one more time before surgery because I want to make sure that we're on the same page and go over everything again. And I think that's really important. I think that if you have a surgeon that you meet once and then the next time you're seeing them, it's in the operating room, I'm not sure that I would feel comfortable feeling like we're on the same page with our communication. But of course, you have to do whatever is best for you and how you feel most comfortable with the communication level. Do any of you guys have any more questions? I'm just going to scroll through here and make sure that I've answered everybody's question. Is side sleeping possible after surgery? So not really. I really prefer that you're kind of on your back in that beach chair or reclining chair position. As you start to heal a little more, when you get closer to that 4-week point, I will say you can start to sleep on your side. But even then, it's going to be more of a back / your side. So still kind of propped with pillows. In the middle of the night, what I don't want is for you to do any sudden motions that puts tension on either your incision or the stitches on the inside, those progressive tension sutures that I talked about earlier. I really want all of that to heal down. It's going to give you the best results. It's going to be the most long-lasting result with no complications. Okay, can you have a tummy tuck with just skin and not actually tightening the muscle? And who is a candidate for this? So that's a really good question as well. So let's say you don't have that diastasis of your muscles or laxity of your abdominal wall. So who might have that but still have extra skin? So that's going to be somebody who's never been pregnant and had that stretching of the tissue, but maybe they've lost a lot of weight. And so their skin, they do still have that excess skin that's hanging in the abdomen. So that is absolutely a possibility, and we do see that from time to time. I would say, especially my male patients, that's going to be more common. That the reason they're seeking abdominoplasty is because they've lost a lot of weight, not because they've had pregnancies. And so often These men will not have a lax abdominal wall. Their musculature is fine. It hasn't been stretched out, but they have a lot of excess skin in the abdomen that we can remove and contour. The other group would be women in the same situation, just women who've never been pregnant necessarily, but they have lost a lot of weight. And some women who have been pregnant, but they just didn't have that same stretching problem, and they feel pretty confident, and I feel pretty confident with their abdominal wall and their core and how strong and flat it is. So I would say that that's not as common. Most women, if I'm there and I'm looking at it, they want me to tighten it up, but it does hurt a little more, frankly, in your recovery period to have the muscles tightened. And so if you don't need it, great, we don't have to do it. So that is the answer to that one. That's a great question. Thank you. Okay, I don't see any more live questions, and I think I've answered all the questions that came in kind of in my discussion. So again, I'm so happy to be able to talk to you. I hope you all learned something, especially between last week's with Dr. McCatten and liposuction and then today with tummy tuck, because the two of them are often asked about and inquired about in the same fashion. So between those two, hopefully you guys have learned something about body contouring. And again, we are always happy to evaluate you. Of course, if you live in the area, we're happy to see you. You can call our office for an appointment for a consultation. If you don't live in the area and you want us to evaluate you virtually, we can do that. We have you send in information ahead of time electronically so we can see your health history, and then sometimes some photographs or a live kind of a live feed just like we're doing now so that we can examine you. Of course, we're going to want to see you in real life before you actually have surgery, but that for folks who want to fly in for surgery or travel for surgery, that can be a really great first step to see if you're a candidate and kind of hear about it before you make that trip. So we're always welcome. We always welcome you doing that as well. So again, thank you so much, everybody. It's been great talking to you. And if you have suggestions for things you want to hear me talk about next week or the week after, you can post those as well or message us. Because I'd love to hear what you guys want to hear about. I can talk about anything. I love to talk. So let us know. Okay, bye guys. Thank you.